Hi there, my name is Jennifer Ellis. I am a nursing student at the University of South Alabama College of Nursing. I will be performing my medication administration checkoff. Here is my badge. All right, I will now scan the room. Okay. There we go. Make sure that you can see everything. Okay. Now, the very first thing that I would do in medication administration is that I would plan ahead for medication administration. I would keep the medication room door closed. I would not take any phone calls. I would avoid all interruptions. I would keep all conversation with colleagues to only essential information, and I would abide by my policy's no interruption zone policy. Now, the first thing that I would do is I would compare my medication order for my patient's medication order form with the MAR. So here we have Jaguar J. Jones, medical record number 417-6352, 417-6352. Mr. Jones is allergic to penicillin. We have an order for Mr. Jones to receive Novolin R regular insulin, U100 insulin 10 units, U100 10 units, subcutaneously 30 minutes before meals, Right, it is coming up on 30 minutes before meals, and he has not had this medication within the past several hours, so it is safe for me to proceed to prepare this medication for him. Next thing I would do is I would take the MAR and I would go to prepare the medication. I would then perform hand hygiene, and this will be my first check of accuracy. I will find the correct medication, which here it is. So here it is. I got Novolin R regular insulin, expiration 12/1/2025. Let's see, Novolin R insulin 12/25. And he is to receive this subcutaneously every 30 minutes before meals, and it is 30 minutes before meals, and he has not had this medication within the last several hours, so it is safe for me to prepare. And he is getting this subcutaneously, so I have chosen a good subcutaneous needle. So we have Novolin R, 10 units, 30 minutes before meals. It's 30 minutes before meals. So, next thing I will do is I will clean the top of the vial. I would draw back 10 units of air because we are going to be drawing 10 units of insulin. So we are going to be replacing the insulin with air that we will be taking out. So I'm injecting it, and I'll be withdrawing 10 units. I'm going to withdraw a little bit more than 10 units to account for air bubbles. And at this time, I would also verify, if needed, any kind of calculations with another nurse. So I got 10 units. Can you see that? 10 units. Okay. So I will perform use the scoop method to scoop the top back up. Okay, so now I have Novolin R regular insulin, Novolin R regular insulin, Novolin R, 10 units, subcutaneously, This is 10 units subcutaneously. This is a good subcutaneous needle. And it is to be given 30 minutes before meals. It is 30 minutes before his meal. And he has not had this medication within the last several hours, so it is safe to proceed to give him this medication. The next check for accuracy is I will prepare a label. On this label, I will make sure I have the right patient, Jaguar J. Jones. And it says Novolin R, 10 units of Novolin R insulin. Novolin R insulin. Novolin R insulin, 10 units. Subcutaneously. This is a good subcutaneous needle. And it's to be given every, see, I'll put Novolin R. Novolin R, 10 units. 10 units. Sub-Q. Right, and it is to be given 30 minutes before meals, and it is 30 minutes before meals, and he has not had this medication within the last several hours, so it is safe for me to continue to prepare this medication for Mr. Jones. I put my label on. Next, I will take my Mr. Jones syringe, the vial of medication, and I would also take the medical record number, and I will proceed to Mr. Jones' room. Once in the room, I will perform hand hygiene. Next, I will verify I have the correct patient. I have Jaguar J. Jones. Jaguar J. Jones. Medical record number 417-6352. 417-6352. Let's see, Mr. Jones has an allergy to penicillin. Allergy to penicillin. And at this time, I would ask Mr. Jones if he had any other allergies that is not stated or recorded in his medical record. He states that he does not have any more allergies. So, okay. Well, next, what I would do is I would raise the bed to a proper working height. I would lower the side rail. I would then perform any kind of pre-assessment on Mr. Jones prior to giving him this medication. And next, I will don my gloves. And I will also be explaining to Mr. Jones what I will be doing. Mr. Jones, I am here to administer your insulin. It's 30 minutes before your meal, and I was going to administer your insulin so that way your blood sugar would be maintained and be normal for you to have your meal. I'm sorry. So pre-assessments look good. Right. Next, I will assess for a proper injection site. And in the proper injections, what I'm looking for in the injection site is any kind of bruising, any edema, tenderness. So, because this is a subcutaneous injection, I'm going to be pinching the skin. If I could pinch 1 inch, I would go in at a 45-degree angle. Pinching 2 inches, like I will go in at a 90-degree angle. So, because I pinched 2 inch, I will go in. Alright, and then I would release, then inject slowly. Alright, then pull out and put slight pressure. I will discard my syringe into the sharps container. Okay. I will help Mr. Jones back into a comfortable position. I will assess him for any kind of allergic reaction. Next, I will then raise the rail I will lower the bed. Mr. Jones is not having any kind of allergic reactions. So next, what I would do, I would perform hand hygiene before leaving the room. I would go to the nurse's station and I would document how the patient tolerated the procedure, how he tolerated the medication, if there was any adverse reactions that had occurred. Shortly thereafter, I would return to Mr. Jones' room to assess him once more to make sure that there is still that he is still doing okay and that there are no allergic reactions that or any kind of adverse reactions to the medication. Thank you very much. That is all.